Thank you, Rebecca. Well, I'm going to bring us from the very superb ground level observations you just saw to sort of a much more generalized approach to the issues. I've been involved in environmental health since before the first Earth Day, and among other things have been assistant administrator for research and development at EPA, so I feel for the folks who are trying to do the regulation and get the science right behind it. Our experience in Pittsburgh, in the southwestern Pennsylvania with the Marcellus Shale has been one that has led me to think that I was back in New Jersey in 1980 when I first got involved with developing programs with state health departments. It's something that should not be followed in the sense that it's really hurt the industry, and that's the case I'll try to make. I've heard a lot of people understanding today how working with the public and getting to understand what where the public's coming from is crucial for, if you will, your social license to operate as an industry. That same thing is true with after the Deepwater Horizon, before the Deepwater Horizon. I'm still involved to the extent that the National Academy of Sciences was given $500 million from the criminal part of the settlement with Department of Justice to do research to try to prevent this the next time, to try to deal with the issues ranging from health to all of the other things that are important, including the preventive aspects that you've heard so much about. That money is yet to be spent. It's going to be over 30 years. The Academy really doesn't know how to fund research. It doesn't do that usually. It forms committees, so it formed a committee, and I'm on the committee. And we're going through a lot of the kind of issues I heard here. How does one work preventively? What kind of approaches need to be taken to be sure the employees are empowered to be able to work in a way that's most effective? So I'll go through that very quickly. I'll talk about benzene. Benzene, I'm a hematologist by training, so benzene is something I've probably written 150 papers on. But I'll do it very quickly because it really is less important than I think some of the other issues are, which have to do with mental and behavioral health and the whole safety culture that is part of public health. There's an allowable workplace standard of benzene of 1 part per million. That's 1,000 parts per billion. We heard about 1.4 part per billion as being an annual average. Of course, this is not an annual average. The issue of the benzene standard and what to do about it is important. But what I was particularly impressed with is reading about the recent pipeline accident in which, according to the press reports, workers could not get there to deal with it because of the benzene levels in part. And it wasn't clear, and I made a couple of phone calls, and I'm still not clear as to whether that represented an issue having to do with an explosion or fire, or that was because of the benzene levels being sufficiently high above the workplace short-term exposure limits, and people are shaking their head. Well, if that's the case, if it's the latter, that brings up the issue of are there people trained to use personal protective equipment to be able to go in and respond? Are the responders trained in that way? And one hopes they would be, because benzene is going to be pretty common in these kind of situations. Benzene basically leads to leukemia. It is a very potent cause of human leukemia. Toluene has many of the effects of benzene on the central nervous system. So does ethylbenzene and all the and xylene, but does not cause any of the hematological effects. It's a very specific toxicological thing. Industry, when this was first finally hammered in that yes, this was occurring, basically argued, well, there must be a threshold. There must be some level below which benzene was not causing this. In fact, it's almost the opposite. The data today is pretty clear that it's almost a hyperbolic curve, that per unit benzene, lower levels are more potent. Now, it's per unit, so that the more benzene you're exposed to, the worse it is. But that because of saturation of kinetics of some of the more toxic metabolites, we do have a reason to say that every molecule of benzene has some at least potential to cause the mutation that leads to leukemia. Now, at 1 part per billion, Background, you're breathing about 1 trillion molecules of benzene in every breath. The background likelihood that it's going to cause leukemia is tiny, but it's not zero. And that gets into an issue of how do you talk to the public about this when there is benzene coming out. And you will get some benzene in natural gas. You will get some benzene certainly in crude oil. So a lot of your pipelines will have benzene. The central nervous system effect, the anesthetic-like effects that says it shares with other compounds like it is not to be laughed at. It is a closed, if you're in a closed space, it will kill. There's probably as many people, at least in the past, who are dying industrial accidents due to the anesthetic-like effects of benzene, which a worker would get woozy and fall over into a vat. That basically outweighed the number of deaths from the leukemias. But the public focuses on the leukemia risk because obviously that's something that affects them and their family. I come at this from a health scientist, and from a health scientist point of view, we're a little less concerned than just with leukemia. We're more concerned with this broader issue of well-being. What is it that allows you to say that you're feeling well? And what I'm going to show you is that there's a whole bunch of folks out there who don't feel well in relationship to some of the issues that have arisen from than just with leukemia. We're more concerned with this broader issue of well-being. What is it that allows you to say that you're feeling well? And what I'm going to show you is that there's a whole bunch of folks out there who don't feel well in relationship to some of the issues that have arisen from certainly from shale gas, Deepwater Horizon. But I thought I'd start with taking this quote, which started after I was asked to start to look at some of these shale gas things. And here's Governor Bentley of Alabama, recent pipeline issue. And he's talking about this pipeline rupture, and he's got, though I'm not sure if it's a rupture after I heard the words today being carefully defined, but it's certainly a release. And he praised the response, and he says, we don't know that it won't happen again. That's like saying, is there a tornado going to happen again? That, from a public health point of view, while understandable, is absolutely inappropriate. Comparing a tornado with a pipeline, with a technical accident, is something that we try to avoid. This is the classic Deepwater Horizon picture. To make the point, I can't do this, but my graduate student can. What you saw before was an incident. This is an accident. This is not an accident. This is an incident. This is something that is fully preventable, should have been prevented. Now, with pipelines, you've got something in which the technology is superb. I mean, everybody is in the idea that you can send something 1,000 miles, or that you can get this done, is amazing. So that when you say, gee, corrosion's inevitable, if you do say such a thing, pipeline's inevitably going to leak. Oh, come on, you guys know how to do that. You're just not willing to spend the money. You don't care about us, is what the response is inevitably going to be. You heard about the exposure assessment as being so central to public health, to any sort of environmental health. This is the classic 5 elements of a complete exposure pathway. I want to focus on the receptor population issue. And when you get into the Deepwater Horizon, this is not just something that happened as an oil spill. It happened in a specific community. Your pipeline releases will occur in specific communities. And these communities will have different dimensions. In the Gulf, a major dimension is that these are unhealthy communities. This is the classic statewide kind of comparison, but we went further and we looked at the county comparisons. There's something that I've been involved in called the Gulf of Mexico, the Gulf Region Health Outreach Program, which is $105 million of the $7.6 billion in the toxic tort settlement, which the judge basically said, look, these communities are being affected. They're being affected in ways that a classic tort settlement is not going to really get to the bottom of. And so here's $105 million. It goes to federally qualified health centers. It includes bringing mental and behavioral health in. And I'll show you a little bit more about it. But the 17 counties and parishes that were specified, if you look at them, they're really very poorly off. Here's one example. From a CDC approach, a Centers for Disease Control approach, which is trying to look at comparative ranking of counties, which include the various social determinants of health. So this is Bay County, Florida. Its comparison are other counties which have the same statistics, if you will, about education level and poverty level and average income and all of the other things which we know play a role. So this is not a comparison with Palm Beach County, for instance, in Florida. And even when you compare in that way, you still find more of these social determinants of health, and these are cancer deaths, lower respiratory disease, coronary heart disease, et cetera. Male life expectancy, female life expectancy are really pretty poor in the Gulf. We know about health disparities, about what's rightly called environmental justice, that there are more sources of adverse problems having to do with the environment in disadvantaged communities. They're much more likely to be able to fend these off. They're very often likely to be disadvantaged because they have so many of these sources and no one else wants to live there. We also know that people in disadvantaged communities generally tend to have poor health, and we also know that if you take just about any pollutant, people in poor health are going to have more of an effect from that same pollutant than people in good health. So in essence, that sort of conditions the fact that when you have something like Deepwater Horizon or any sort of pipeline problem, you've got to be aware of what the community is and what the community dynamics are, because they will affect the health. Early on, I was asked to write a review article about Deepwater Horizon for the New England Journal of Medicine. My first question was, why are you asking somebody from Pittsburgh? These are local things, and I was fortunate to get Howard Osofsky, who chairs psychiatry at LSU, and Maureen Lichtveld, who chairs environmental and occupational health at Tulane School of Public Health, to work with me on this. And very early on, it was obvious to us that the potential health consequences would be worker safety, and we certainly saw that. Toxicological effects in workers, visitors, and community members, mental health effects from social and economic disruption. Again, from social and economic disruption. We're not talking about a direct effect of the pollutants on the people. We're talking about social and economic disruption and the ecosystem consequences. And similarly, the Institute of Medicine, in reviewing this, came up with the same points. Psychosocial impacts may predominate. There's a lack of trust. And I'll go through this quickly to see if we can make up some time. But why does this happen? Here's a classic example. If this was a room full of local people here in New Orleans, and I asked the question, were you aware of the fact that the dispersant contained a secret ingredient? Everybody would raise their hand. Did that worry you? Everybody would raise their hand. You know what that secret ingredient turned out to be? This organic sulfonic acid salt, proprietary? It's the commonest over-the-counter sold in the U.S. laxative. Okay? As a toxicologist, I'm not worried about something that's sold in 1 million doses a day in the U.S., at least not worried about what it does to people. Maybe a fish, it does something, but why was this kept secret? I mean, that's, if you will, good news, don't worry about it. The industry kept it secret. I mean, it would take $10 worth of analytical equipment to find out what it was by any of its competitors. This is what we tend to do. Our lawyers say, keep that secret. No, don't keep it secret. Let the word out. Be sure that you level with people. All it did is contributed greatly to the sense of unease and dislike of BP and Transoceanic and the others. So we're having a similar thing with the shale gas. Here's 3 statements that come out of the congressional testimony of the Secretary of Environmental Protection of the state of Pennsylvania, working for a governor who's strongly in favor of shale gas. All 3 of these statements are true. All 3 are false. This is the kind of slippery way you can present things if you want. All have come out to hurt them. There's been a misconception that the hydraulic fracturing of wells can or has contamination of water wells. This is false. Well, yeah, if you define hydraulic fracturing, the successful release of chemicals 5,000 foot underground, it's probably not going to get to the surface. But to the public, hydraulic fracturing is fracking. It's anything from the time that they level the drill pad to 20 years from now when you're going to leave. And will it contaminate my water is a perfectly appropriate question. And the answer is, yeah, it does. If there's a well spill, if there's a spill of a truck, if the wellhead breaks, and the public is reading about such and such community being put on bottled water, at the same time they're hearing from the industry that there's misconception. Hydraulic fracturing is only a temporary feature of natural gas development, which only lasts a few weeks. True, only lasts 2 weeks. But they're doing sites these days, they're doing a dozen different fracs, all in different directions. Can't do it simultaneously, they do it sequentially. It's not 2 weeks, it's 6 months that this is going to be going on next door to you. So what do you say something like this? It's not new in Pennsylvania, it's been going on here since about the 50s, and it's been standard practice since about the 80s. Oh, well, yeah, it's been done for years, but not in the quantity, not 5 million gallons, not in a way that it gets, it basically overcomes all the wastewater treatment, not in a way that you now suddenly have to put it in deep underground injection wells, which we didn't do in Pennsylvania before, and so we ship it to Ohio, and we get earthquakes. This stuff is coming up from underground. It's basically causing at least the risk of adverse effects in ways that have not been focused on. Industry's done a superb job getting the focus on hydraulic fracturing fluids. These are pretty harmless. And if you don't believe me, just take a look at the websites, and you'll see about a half a dozen instances of industry folks actually drinking their hydraulic fracturing fluid to show you that there's no problem. You will find 0 instances where they drink the stuff coming up from below. That flowback fluid is plenty toxic, and no one's going to drink it, but that's what's at the surface, not a mile underground. What you've got is a social amplification of risk caused by by the fact that people are less concerned about risks that they're familiar with, and they're more concerned if they don't trust you. And that's what's happening here. It causes adverse effects. Here's the stressors in people who believe their health has been affected. I don't know that their health has been affected from hydraulic fracturing, but they believe it. And if you look at what they're complaining about as their stressors, it's denied or provided false information, corruption. You get down to noise pollution. That's at 45%. Lower than that is the water tastes bad, the air smells bad, things that are usually considered as the physical causes. These are things that must be avoided. And what about pregnant women? You can have spills. There'll be some pregnant people nearby. We don't know what weathered oil does to pregnant people in New Orleans. We just didn't have that information. We still don't have it. And the things that get out, it's nice that benzene, toluene, xylene gets out, but it doesn't stay as benzene, toluene, xylene when it gets to the public. We need to know more about that. So let me get to the point, and I'll finish with this, that the lack of these scientific studies, the lack of getting the information, has basically cost the pipeline industry the opportunity to do more pipelines in Pennsylvania than it would have otherwise, and in New York. When our Chief Justice in Pennsylvania used an environmental provision of our state constitution to say that, oh, we've got to stop you from doing part of what Shale Gas folks were doing in Pennsylvania, throwing out part of our law that was very pro-industry, pointed out that there was no information, that there was no evidence that the Commonwealth had ever done any studies, and that the Commonwealth had failed to discharge its trustee duty. This is because they used a provision of our environmental part of our amendment to our Constitution, and basically took anecdotal evidence from local communities that the plaintiffs had put up, saying, oh, they had nosebleeds, they had these other things. I don't know if that's a real association, but they used that, and basically when the governor said, oh, you should have had an evidentiary study, they said, well, but there was no study, that you never did any study to look at this. Governor Cuomo basically said no in New York State because there was no data available. This is a classic precautionary statement. Until the science provides sufficient information to determine the level of risk, we should not do a high-volume hydraulic fracturing in New York. And the Times basically said, look, this is not stopping this forever. This is stopping this until the scientific information is available. The idea that we should not get that scientific information because it might turn out something bad for the industry has actually turned around and hurt the industry. Your situation is one in which you're going to have to deal with the diffusion of the risks. You've got this kind of issue that is going to continue on. The pipeline is now gotten diffused into meaning something more than what you're talking about, something that's negative, Keystone, any of these others. I think what's crucial about this New Yorker article is the word pipeline doesn't appear anywhere. And so you're well into the article. It's not about pipelines, it's about native rights. And as my last slide, this is, I just last week was at a dentist in an area, it's an old Italian neighborhood in Pittsburgh. It's reasonably conservative. Trump will probably get the majority vote there. Well, what's a bookstore there talking about respect native sovereignty, stop pipelines? It's sovereignty that it's about. You're getting self-stuck into an issue that isn't your issue. This isn't really, if you will, directly about you, but it certainly affects you. And it's affecting you because there's been less than clarity in dealing with the public. There's been obvious attempts to mislead the public. And sorry, you're part of the folks who probably did this, according to the public. Thank you.